Hello, my name is Nystagmus for Wernicke'S Encephalopathy. Definition: is a neurological and eventual psychiatric disease caused mainly by vitamin A.
Wernicke'S encephalopathy is a neurological disorder characterized by thiamine deficiency, typically from chronic alcoholism or persistent vomiting. Classically, Wernicke'S encephalopathy is characterized by triad ophthalmoplegia, ataxia, and confusion. Ataxia is loss of coordination of the muscles, especially of the extremities. And difficulty in walking. Ophthalmoplegia is weakness or paralysis one or more extraocular muscles which are responsible for eye movements. Nystagmus is rapid, involuntary and oscillatory movement of the eyeball, usually from side to side. Confusion refers to loss of orientation or ability to place oneself correctly in the world by time, location, and personal identity. Mental confusion is sometimes accompanied by disordered consciousness.
Application in medicine. It is estimated that encephalopathy is present in 2% on general population and that less than 10% on cases are diagnosed, probably because they not present the expected class symptoms. Its prevalence is 6 times higher among those who above the call.
In this video, we are going to go over a simplified way to understand the concept of nystagmus, which is commonly seen in patients with vertigo. Nystagmus. Before we can dissect how nystagmus works, we must first understand how the eyes cooperate with the vestibular system while our head is turning in space. Vestibulo-ocular reflex that allows us to keep our gaze fixed on the same point in space while our heads twist and turn. The anatomical portion of the vestibular system that is responsible for this reflex is called the semicircular canals. A set of them exist in the inner ear on each side of our heads. The semicircular canals communicate with neurons that will form the vestibular branch of cranial nerve 8. At rest, there is a baseline level of firing of these neurons at a smooth, constant rate. When we begin to turn our head to the right, the fluid inside the semicircular canals is displaced and signal to the adjoining neurons that we are turning. The key to understanding all of this is that it is not the absolute amount of firing of these neurons, but the relative difference between the left and right sides during different motions that determines what happens with the eyes. The side we are turning towards, the right, becomes excited, while the side we are turning away from, the left, becomes inhibited. So in our case, the eyes will slowly turn to the left, and the eyes remain focused on the same point in space. Then as the head continues to turn to the right, Again, the eyes will slowly turn to the left until they run out of room again and quickly jump to the right again. These slow and fast phases of eye movements will be helpful to us as we try to localize the problem in a patient with nystagmus. Imagine this time that the head stays fixed in place and the semicircular canals on one side of the head, the right side, become activated on their own in the absence of head turning. The right side becomes excited while the left side stays the same. Remember I said that all that matters is the relative difference between the two sides. If the right side is activated while the left side remains the same, there is a net excitation on the right side and a signal is sent to the eyes that the head is turning when in fact it is not. What will happen to the eyes? The eyes will slowly turn to the left and then rapidly turn to the right. Slow to the left, fast to the right. These involuntary eye movements are called nystagmus. Patients with vertigo describe that the world around them is spinning. This is caused by nystagmus of their eyes that is directly related to a unilateral problem with overfiring of the neurons attached to the semicircular canals on one side of the head. If there is a problem resulting in overfiring on the right side and the head thinks it is turning to the right, the eyes will slowly move to the left and then quickly jump to the right. A way to remember this is that the fast movements are pointing you to the side with the problem. There are actually 3 sets of semicircular canals that balance our gaze in all the possible ways our heads can move in space. This video was only to help medical students understand what causes nystagmus and how it can be localized if you see it in patients. Thanks for watching.
Pros. Pros. Most symptoms improved with surprise rapidity, especially in the eye treatment early, but in which the exception of memory loss that by because permanent. Cause. What is diagnosed by a triad of symptoms consists disturbance in ocular mobilization, uncurled dwelling, and confusion.
Thanks for joining us on EM in 5. Today we're going to be talking about Wernicke'S encephalopathy. Wernicke's encephalopathy is an acute neuropsychiatric syndrome. It's caused from thiamine or B1 deficiency. Basically, you have poor nutrition, which leads to the deficiency. This depletes the intracellular stores, which leads us to cell death eventually. And the reason thiamine is important is because it's a cofactor for many of the really important enzymes in energy metabolism. And thiamine is needed the most in a couple different situations: when metabolic demand is very high in order to make the energy, and also when glucose intake is very high. And we'll remember that for later when we're talking about treatment. Now remember, Wernicke's affects the brain most specifically, and that's because metabolic demands and needs of thiamine are very high in the brain, and also thiamine turnover is very high in a couple of the different areas. Now, normally we think of this as a disease of alcoholics. We do see about 90% is related to alcohol abuse, the deficiencies are, but all these other things can cause deficiency too. It's basically anything that causes a malnutrition or deficiency. So patients that are anorexic or are doing severe dieting, any type of malnutrition or starvation can cause it. People that have a lot of GI losses, so for example, hyperemesis in pregnancy, people with Crohn's disease, and also patients that have poor absorption, so people that have had gastric bypass surgery or other abdominal surgeries affecting absorption. While we mostly see this in the ER in alcoholics, it's not really just the alcohol intake specifically that increases their risk. It has to be a component of malnutrition as well, which is why we tend to see this more in people that are homeless and alcoholics, because they have poor intake. So you have to have poor food intake. There also has to be a component of low absorption, and alcoholics get this specifically because they have some duodenal mucosal damage because of the alcohol, and they also have poor hepatic storage. So all of this comes together and really makes alcoholics that are malnourished our most high-risk population. Okay, here's a little board's question for you. What do we see in 80% of brains on autopsy? Good, well the answer is down there at the bottom. It's mammary body atrophy. Okay, let's talk symptoms. So there's a triad that you'll see in these patients that you really need to look out for and have a high clinical suspicion for, and that's altered mental status, diplopia, and ataxia. So let's talk about each of these. As far as the altered mental status, this could be confusion or even just inattentiveness, agitation, it can be disoriented. We see this in a lot of our alcoholics, right? So that's not that helpful for us, which is why I think it's the second two you really have to pay attention to. For diplopia, other things you can see is nystagmus, which you do see a lot in alcoholics, and also a lateral rectus palsy. So you can see that down in this patient here. You're asking him to look over here towards his left, and he has lateral palsy in the left eye there. And then the result of this is you'll get diplopia. So ask your patients, are you seeing double, when you're doing your exam? Here's a really great example of nystagmus in a patient. You can see it on both sides here. This is in a video posted by USD Medicine. I have a link at the end.
Uses applied in Ecuador. A historical case series report mortality in 7 of patients with acute Wernicke'S encephalopathy, or the remain 45 given of the low parental time. Her irreversible memory imparting concept with cartonal syndrome. Conclusion. Wernicke'S encephalopathy is a neural disease due to thiamine deficiency and especially affect alcoholic to do poor nutrition. Thank you.